Gathering near the State House in Annapolis, nearly 24 students from the University of Maryland School of Nursing had a common purpose: get acquainted with their state delegates and senators in group settings, or better yet, one-on-one, so the lawmakers will grasp issues facing nursing education and future nurses as the Affordable Care Act takes effect. The 2013 School of Nursing Advocacy Day began with a send-off from the new dean, Jane Kirschling, and insights from University of Maryland Baltimore President Jay Perman on interacting with lawmakers whom each student would shadow.
As you go about your day, bring voice to health care. Bring voice to the patients that you have cared for or that you're going to care for. And bring voice to nursing because we are the largest discipline. We play an extremely important role in terms of the health care that's delivered in this country.
It's encouraging, simply as a citizen, to come down to Annapolis once, a couple times a week during the time that the legislature is in session and engage with our governmental leaders as you will today. Many of them are professionals themselves. Several are nurses. A few of you will have an opportunity to engage with them. Many are lawyers. They are an intelligent crowd, but they are the first to admit that the advantage to them of you coming down and interacting with them is that they learn things. They learn things from each of you.
Students made key points with lawmakers they shadowed. The school provides more than 40% of Maryland's nurses. Fewer nurses would limit access to care and jeopardize patient safety. It's good business sense to invest in a sector that continues to grow. Interprofessional education helps build a patient-centered healthcare system. Education of nurse practitioners helps expand access to primary care, and education at higher levels strengthens faculty to ensure the state's supply of nurses.
We want to thank them for their support and continued support of nursing education. It's important that we have loan repayments that are supported by our legislators, and also the importance of training the next wave of faculty members. So we have a nursing shortage. We first of all need their support in enticing people to come into that profession. And second of all, there's no way to train all these new nurses that we need if we don't have faculty in place trained to do so.
One student got advice on how a nurse can use the profession as a springboard to the General Assembly. That's what nursing alum Shirley Nathan Pulliam did.
After about maybe 10, 15 years of working on different people's campaign, I finally decided, something, I can make just as good decisions as they have. I said, I'm going to use this nursing process, and I'm going to analyze everything, and I'm going to run.
The University of Maryland does a really terrific job of educating nurses at a wide variety of levels, from the bachelor's degree to the master's degree to the DNPs and the doctorally prepared nurses, and also PhDs who are needed in terms of moving forward and being nurse educators all across the country and in Maryland. We need nurses at all different levels to provide care in the state, because each level of nursing provides a slightly different aspect of care, and they fulfill an important role in the healthcare system. We really could not provide healthcare to all the citizens of the state of Maryland if we didn't have nurses in each of those roles who are well prepared to do their jobs and to fulfill their mission.
The highlight for the nursing school's delegation of students and faculty came as the group observed deliberations in the House chamber, where Dean Kirschling was officially welcomed to Maryland.
We'd like to welcome Dr. Kirschling to the University of Maryland and to the Maryland General Assembly, if you'd like to come forward.
So thank you for that very warm welcome. It is truly an honor to serve the citizens of Maryland as the Dean of the School of Nursing, and I hope that we can continue the long tradition of preparing well-educated nurses for all of those individuals in your places that you represent so that they can get high-quality health care. So it is an honor to serve as the Dean, and thank you for this opportunity.